Pelvic floor is for peeing, pooping, procreation, and what I love to add to that now is pleasure too. So when it comes to yeah, right? We don't talk about that one.
Please look away from the incontinence pads. That's not the fix. And I don't mean to laugh, but those commercials are just such in the top of my mind because they make it seem like that is the fix all.
Hi, and welcome to the Motherhood Kit. I'm your host, Yamel Belen, a registered nurse, doula, lactation expert, business owner, and most importantly, I'm a proud mom of 5. Join in weekly as I share my wisdom and dive deep with parenting experts to empower you with your very own toolkit to help navigate the ever-changing seasons of motherhood. From prenatal excitement to the real, raw, sometimes harrowing, and often hilarious sides of mothering. So whether you're seeking guidance, camaraderie, or just want to lighten your load with loads of laughs, the Motherhood Kit is your safe space to connect, learn, and thrive. Let's dive in.
I know we've been discussing tantrums, yelling. We've even been touching on bedtime routines and having better sleep. But today we're going to switch gears just a little bit. Have you ever had some leakage after you sneeze or felt discomfort you couldn't quite explain, or even struggled with core weakness after having a baby? Well, I'm here to tell you you're not alone. Your pelvic floor plays a crucial role in your overall well-being. Yet so many of us are suffering in silence right now, thinking that these issues are just simply a part of motherhood, and that's a lie. In this episode of the Motherhood Kit, we're going to be talking to Saige Evans, a pelvic floor therapist, and we're going to dive into the world of pelvic floor health, what it is, why it matters, and how a pelvic floor therapist can help you through pregnancy, postpartum, and beyond. Let's break the silence and talk about how you can restore and strengthen this essential part of your body. Hi, Saige. Welcome to the Motherhood Kit.
Hi, Yamel. Thank you for having me on. I so appreciate it.
I'm excited. We had a live the other day talking about this specific topic, pelvic floor health, and so many people were DMing, and it just still surprises me how many of us don't know what a pelvic floor therapist is, what you all do, that you exist, that they don't have to live with these ailments. So before we start yapping, I would love for you to introduce yourself to our audience and tell them a little bit about your work.
Absolutely. My name is Saige Evans. I am a pelvic floor therapist and clinical director at Bloom Pelvic Therapy in Tampa, Florida. I am an occupational therapist. So I'm trained a doctorate in occupational therapy, and then I went on to specialize in pelvic health. I have an extra special place in my heart for pelvic pain and sexual health and wellness specifically. And I love what I do, and I love getting to collaborate with other professionals in our community, like One Love. So thanks for having us on.
I appreciate you. So tell me, to become a pelvic floor therapist, do you have to have some sort of training beforehand?
Great question. Yes. So when looking for a pelvic floor therapist, something really helpful for people to know is that pelvic rehab provider should really be a physical therapist or an occupational therapist. So we all come in with a different level of degree, sometimes depending on when someone entered the field, but a prerequisite for becoming a pelvic floor therapist and specializing in pelvic health is being a physical therapist or an occupational therapist. So I work with both. I'm an occupational therapist or an OT, and we have PTs on our team too. So our clients don't really know the difference if they're with a PT or OT. We're all pelvic floor therapists, but that is something to look for, to keep in mind when you're looking for a rehab provider.
So, of course, our podcast is the Motherhood Kit. So most people listening are moms or wanting to become moms, right? Tell us in plain terms, what is the pelvic floor and why is it so important for us to know that you can get treatment for your pelvic floor and also to know what sorts of things to look out for?
Absolutely. So our pelvic floor is the group of muscles that sits within our pelvis. So our pelvis is like right around our waist, or used to that being called our hips sometimes, or our waist. That's the bony pelvis. And the muscles are what's really under discussed, that's sitting like a hammock between those pelvic bones. So we need our pelvic floor to be working well. I always say, someone I follow closely in the field, Nicole Cozine, she mentions pelvic floor is for peeing, pooping, procreation. And what I love to add to that now is pleasure too. So
Oh,
when it comes to
yes.
yeah, right. We don't talk
Yeah.
about that one enough,
Nope.
especially. Nope. So when we talk about moms or those trying to conceive or maybe in motherhood now or about to be in motherhood, why does pelvic floor matter? Well, we really need the pelvic floor, those muscles in there working optimally or to have the right tone, strength, and function for things like going to the bathroom, things like relaxing the muscles when it's time for birth, things like having adequate circulation when we're healing after birth, whether vaginal or cesarean birth. We need the muscles working well for optimizing our bowel movements or reducing the stress of constipation that sometimes can accompany the motherhood journey too. So those are a few ways pelvic floor is involved there. Sexual health as well, as people are navigating what that might look like during a pregnancy
Mm-hmm.
or when trying to conceive, and postpartum too, with the many changes that happen with our bodies.
And so the way that I kind of started learning about pelvic floor therapists, of course, I learned as a nurse and in my doula world when finding complementary services for our clients for different things. But I kind of became more curious because I would bump into people that would say to me, well, you pee when you like work out, right? And you pee when you laugh because you must do that because you've had 5 kids and 5 pregnancies. And I just thought to myself, whoa, like, no. Like, first of all, TMI, but no, I don't. I don't, thankfully. Now, I'm not saying that to like glow. I didn't do anything, I would say, different than you might have done for your pregnancy or somebody listening. That's just how my body is made up. But I started learning about it because all the women that would approach me with that would think, no, that is not normal. So incontinence, leaking when you're laughing is not normal. Or when you're working out. I had a friend one time that told me, you're brave for wearing, it like our workout clothes. She was like, you're brave for wearing a different color than black. And I was like, why? Because of the sweat? And she goes, no, because of the pee. Everybody pees when they work. Every mom pees when they work out. So talk to us a little bit about the different concerns that people come to you with, or maybe a concern that a listener is having that they may not even be thinking that a pelvic floor therapist could help
For sure. So glad you brought this up because it's so
with.
commonplace to me in this field and to our team that if I were to go back and rewind and listen to what I just said, nowhere in there, I don't even think I'd mention incontinence or urinary leakage because we normalize it so much. But you're right. And we talk with clients all the time that, yes, that's a common experience. And no, there's no shame or guilt if that is happening to you right now. But you don't have to live like that. You don't have to
Hmm.
settle for that being your normal. So, okay, I can only wear my black leggings because I don't know I don't know if there's leakage that's going to happen or something else going on. So, yes, 1000% urinary leakage could be something related to jumping, coughing, sneezing, laughing, moving, picking your baby up, playing hopscotch with the kids. Or it could be something accompanied by leakage, accompanied by urgency, where, okay,
Hmm.
I really got to pee. Let me run to the bathroom. I don't know if I'm going to make it there in time. I'm getting the door. I'm pulling the lock shut. And right then we lose it all. So that we commonly see and help people with that. And honestly, believe it or not, more often than not, urinary leakage is one of the quicker and easier things for us to help people correct. So it's one
Mm.
of the things people might think, well, that would take forever. This has been going on for I haven't had I had my baby 20 years ago. There's probably no hope for me. That's not true. There's a lot we can do. And of course, the longer something's gone on, sure, it may take a little bit longer to correct, but people would be surprised. That's one of the things that's like first on the list to tackle. Another thing you mentioned was what's something that people may be dealing with day to day that not even realize pelvic floor can help with urinary frequency. So
Mm.
that peeing where man, I just went to the bathroom, but it feels like I could go again. I just went 30 minutes ago, but I kind of feel that inkling like I could really pee right now. And sometimes it's like right before people fall asleep. I feel like, oh, I got to get up again. I feel like I need to go again, or waking up at night, peeing all the time. So urinary frequency urgency is another big one that a lot of times people don't know isn't normal. Really normal is peeing once every 2 to 4 hours, to give people a little bit of a framework there.
So I love that you mentioned you don't have to live with this discomfort, because as a nurse and as a doula that has held hands with people in the postpartum space, I cringe when I see commercials or ads for the incontinence diapers, like the incontinence underwear, because I'm like, that should not be the fix. That should
No,
not be the fix. And I love that you mentioned that even if you have been living with it for a long time, it doesn't mean that it's going to take a long time. I had another episode early on when we launched Motherhood Kit, and I had Dr. Katie Props, who she specializes in I'm gonna mispronounce this, right?
yeah.
Gynecologist. She's a urogyno. So she specializes in
Right.
surgery for those specific areas. So let's think like prolapse, or you're
Right.
having issues with your bladder, things like that. And I love that even in her episode, she said surgery is a last resort. She said, you will come to me and I work with amazing pelvic floor therapists that I'm going to link you up with before we go into any. She goes, most of the time, people do not need surgery. They need to see a pelvic floor therapist.
For sure. And I will have to go back and listen to that podcast. I
Yeah.
share some patients with her, so I know that name right away.
Oh, she's
And
amazing. She's
she
amazing.
is, and she's often the first person that, if someone did have a significant degree of tearing or a birth injury, sometimes she'll see them right off the bat, week 1 or week 2, and she's having a lot of those sensitive conversations with them that we then, step into the team alongside them and coordinate with too. So I'm glad to hear, coming from a urogynecologist too, that no, it doesn't mean there's necessarily a surgery or the scary thing. There's a lot of conservative options that are out there, even from a doctor's perspective.
Yeah, I think a lot of times we're afraid to bring things up to our providers or to even seek out something like a pelvic floor therapist, because we think, oh, it's going to be like drawn out and I'm going to have to be there week after week after week, when the fix can be simple. I know when I saw pelvic floor therapy, I was having a lot of hip pain and
Okay.
lower back pain, which would just come about just weirdly. And
Mhm.
I decided to get a consultation because I'm like, okay, Yamel, like I was talking to myself and I thought, you've had a 5 pregnancy. So your body has gone through so much change, specifically your hips and your lower body. And I realize I know, of course, like we carry a lot in like our uterus, our all of that area as women, we just carry a lot there. And I saw my pelvic floor therapist, I want to say probably like 3, 4 times. And then I had some homework. I had some things to do. I can't say, oh, I was cured right away, but I did feel better. I know what to look for if I need to go back, right? And it wasn't so intense. I find that a lot of times we don't seek out help because we think it's going to be too intensive.
Absolutely. And I'm really glad you mentioned your own experience with some of that pain, because that's something that we see a lot too. Sometimes tailbone pain, in pregnancy or afterwards, back pain, and other aches and pains that people aren't really sure. And this is just par for the course as well. And everyone's plan is different. So there are some folks where, okay, what might work best is let's get some consistency and rebuild the foundation and how your body's moving, get you feeling better. That could look like once a week to start. And then we go down in frequency and meet that person where they are, and filling in the in between with, as you mentioned, a solid home program, because we're not the fixers, and it's not, we really don't like to operate that way. And we're not
Mhm.
mechanics to fix anything. We're a partner to collaborate with to help make that person feel the best, not while they're here for the hour, but at home in the in between. And then when we're just a phone call away too.
Now we've touched a little bit on pelvic floor and moms. So moms, you
Right.
would have probably had to have been pregnant. And I do want to go back to that, but can we touch on a little bit of different concerns that you may have, and maybe you haven't been pregnant yet and there are some things that you're noticing related to your pelvic floor? What sorts of things do people approach you with?
For sure. So one that can sit in the camp of either moms or people that have not had children and have no perhaps no plan to, or it's not for a while down the line, prolapse or pelvic organ prolapse. We haven't really touched on much yet. And I failed to mention it earlier. That's something, if we go back to your current question, as far as people that are not moms, what something might they be dealing with? Prolapse is one where a lot of people think, well, I had to have had a vaginal birth to have had prolapse. Or there's this common
Mm,
misconception I noticed where, but I never had kids. How could I have prolapse? That doesn't make sense to me. And while vaginal births in several can be a risk factor, among other things, for prolapse, you don't have to have had a birth at all to have a prolapse. So that's something that we
interesting.
see commonly. And for those that don't know what that is, that's when one of the pelvic organs, like the bladder, the uterus, or maybe the rectum, is applying pressure downwards or inwards onto the vaginal canal. And that can feel like heavy, feels like something's going to fall out. I feel a bulge sensation. I feel menstrual crampy, but I'm not on my period. So we see that a lot. And there's a lot that can be done to help people feel more like themselves, to your point of without needing surgery. So that's a big, scary one, seemingly scary one people will come in with thinking, oh, I'm nervous to go to a doctor about this. I don't know where to go because I really don't want, I think a surgery is going to be recommended. And I really don't want that. People are often surprised that a lot can be done without needing a surgery with pelvic floor therapy, strengthening or lengthening the muscles if needed. Sometimes a pessary, that's a silicone device that can be inserted or removed, is an option. Sometimes it's almost like a sports bra for the pelvic floor, or things like support shorts. So there's a lot that could look like manual therapies, exercise, strategies for at home for something like that. So prolapse is one of the things. Pain with sex is another one that we see. Pain related to sex, whatever it might look like to that person, but that doesn't discriminate to moms. Only that can be across the board for different women and things that they can be dealing with. So that's another big one that we haven't talked about yet too.
Gotcha. And so I love that you mentioned one of the P's, pee, poop, pleasure, right?
Yes.
Um,
Yes.
I would love to touch on that because, of course, intimacy should be great for all of us. And I have also spoken to women that feel that, well, it hurts and it is what it is. We just don't do it that often. I just kind of like reserve it for special occasions. Why do people have pain during intimacy? Why do some of us have pain during intimacy? And what's the first step with a pelvic floor therapist when it comes to that?
So people may have pain with intimacy for several reasons, depending on what age and stage they're in. So if we're talking about moms, a few things that we will screen for is if there have been hormonal changes that have gone on, because of course they've gone on during pregnancy and postpartum, where we've had huge fluctuations in our hormones. And that can affect the really sensitive tissue or skin that's right at the vaginal opening. We call that the vestibule. If for fun, want a new term, but there's parts of the vulva, and the vulva is the outside part. So the vagina is the inside canal, vulva is the outside part. There's parts of the vulva and of that opening of the vagina that are really, really sensitive to hormones like estrogen, testosterone. The clitoris is also extremely sensitive to estrogen, testosterone too, but no one ever talks about
Mm-hmm.
clitoris. So all of those areas are really, really sensitive to hormones. And in pregnancy and postpartum, there's huge hormone fluctuation. So that's something that we screen for. And if we notice that that could be a contributor, that's where we collaborate with physicians to see if something like an estrogen topical of sorts or something like that would be beneficial to that person. As pelvic rehab providers, we don't prescribe medication, but if we see things that would indicate collaboration with a doctor, then we support that. Now, at the same time, what we see most often is that people are carrying pelvic floor muscle tension or tightness. And if those muscles are tight, then of course, anything going in, anything penetrating is going to be painful. And sometimes there could be pain on the outside too if muscles are tight as well. I always mention if the pelvic floor muscles are tight and tense, then that may be limiting our blood flow or circulation
Mm,
to those sensitive areas like the vulva or the vaginal opening or the clitoris that I mentioned earlier. So we need blood flow to get there, circulation to be moving, our blood to be circulating throughout our body for our muscles to get the oxygen they need, the nutrients and hormones they need. So if the muscles are tight, the right things aren't getting there, and it almost creates this feedback loop. So we work with a lot of folks on decreasing muscle tension. If there's any scar tissue from tearing, which is another really common thing in birth that some people don't really know what to do about or where to go to get help with, then that those things work together as well. So sometimes if there's scar tissue, then the muscles are tight, your body's guarding around that. So I would say those are three different areas off the bat with moms that we look at. There's a hormone related component or vaginal dryness component, if there's muscle tension, and if there's scar tissue.
Okay. And then so we've talked about related to birth. So scar tissue related to birth. So we have to touch on pregnancy. Tell us a little bit about the role of the pelvic floor in your pregnancy and helping you grow that baby.
Absolutely. Now, may I go back for just a moment to
Yes.
something I just caught myself say and challenging my own dialogue here. So I just told you a little bit about pleasure or things that would interfere with pleasure, mainly postpartum. And I'm realizing that my language was very much surrounding a vaginal birth, which is interesting because I had a C-section and I even just caught myself doing that. So I do just want to press pause and mention that a lot of the things I'm mentioning can be common after a C-section too. Don't need to be normal, but can be common.
Thank you for mentioning that because a lot of times we just had a postpartum workshop where we talked about even your body changes and the fact that your lady bits are going to feel a certain way after a vaginal birth and after cesarean birth. And the reason why we touched on that is because there is a lot of dialogue floating around the internet, specifically a fellow podcaster that said something along the lines of, well, my lady bits are pristine because I had a cesarean birth. So I love that you took a step back and hey, this is a safe space for all, but I love that you took a step back because having a vaginal birth does not mean that your lady bits will be not pristine and that
Right.
you will be quote unquote needing help because you're quote unquote damaged. You're not damaged. And having a
Right.
cesarean birth, your pelvic floor can need help as well. So yeah, thank you so
For
much
sure.
for, see you guys, my guests are just amazing. Hello.
Well, it's interesting to challenge the bias when I catch myself, I'm like, wow, I don't know. It's quite interesting to notice and reflect on and why wasn't that top of mind?
Cesarean birth is birth, guys. Let's
It
put that out there.
is.
It is
Yes.
birth.
And it doesn't matter if it was a planned C-section
Mm-hmm.
or an unplanned or emergency C-section. It does. Some people say, well, C-section pelvic floor therapy or C-section and any pelvic pain. That must be only if baby descended to, or if they were pushing for a while and then
Mm-hmm.
both are impacted. No, there could be no, baby may not have been descending up at all, or there could have been no pushing and there's still impacts to the pelvic floor or the vulvovaginal area after. So
Right.
either way, we see sometimes changes with back to that muscle tension, hormones, and scar tissue. All three things can be applied, whether vaginal or C-section.
Got it. Got it. And moving along with pregnancy as well, because of course, the population that I mainly deal with are pregnant people, and the ones that I mainly refer to you all are pregnant or recently delivered. Some common pelvic floor concerns specific to when you're pregnant that people should be on the lookout for and not wait until you deliver to get help with.
For sure. Really common ones we see pelvic girdle pain. This is called so many things on the internet. Pelvic girdle pain, pubic symphysis dysfunction, or pubic pain, joint pain, basically any pain around the pelvis that seems more external or bony. Things like when people go to pull their leggings on or their underwear where they're shifting onto one leg, they feel that pain right there in the front of the pelvis or in their near back or side of the pelvis and the SI joint. So that's a common one. Tailbone pain as well. The bowel and bladder implications like constipation, as an example for bowels, urinary may be more like urinary frequency. Yes, you're going to pee more when you're pregnant, but if it's getting in the way of your day to day, that's something we most certainly help with.
Right.
Leakage. So it's not just, oh, I've had babies and now I'm leaking and should I do something about it? It can be during pregnancy too. So there are things you could do, even though baby's growing and sure, putting pressure on your bladder. Incontinence during pregnancy doesn't need to be normal or your normal either. That's another big one. And then pelvic pain as well. So some of the things we were talking about more in terms of intimacy, pleasure, and sex can, of course, happen during pregnancy. And we support with that. We support that too. As we're talking, like, oh, and this, and this, and this. The list goes on. And it so depends. I'm like, wait, I didn't mention around ligament pain. Sometimes we'll think it goes on. But it just know that if there's something you're like, I just don't feel my best, press pause. Connect with us or someone on your medical team. Like if you have a doula or maybe a lactation consultant you're working with, lean on the people on your team to help get some guidance on what's normal, what's not. Or you could always look us up too or connect with me and our team to see if you need any support, because it's likely if there's something going on that's really getting in the way of your day to day or where you're really not feeling your best, there's ways we can support.
Yeah. I love that you mentioned the different discomforts in pregnancy, because a lot of times people that are pregnant just feel that you should just live with the discomfort because it just comes with pregnancy, period. I was one of those because I always had huge pregnancies, like huge bellies and big babies. And by number 4, I already felt that, okay, this is just me. And I can tell you, I probably would have benefited so much from you all with 4 and 5. Number 5 was my biggest, and I was the most uncomfortable. But I was attributing it to a big baby, right? Because of my medical history. However, now looking back on it and have learned so much about pelvic floor health, if I would have just gone to see you guys, I would have had a more comfortable pregnancy.
Absolutely.
Yeah.
Absolutely. That's interesting to hear too, in terms of what you were attributing it to. Like, well, yes, I'm having, say, back pain or I'm dealing with whatever concern. What must be because they're saying, or this is a big baby, or historically I
Yeah.
have big babies, or it must be because it should be uncomfortable to be pregnant. I'm growing a life. And sure, we know our bodies are changing and we want to give ourselves grace. And yep, things are going to feel different. But if there's support out there to lean into and there's something that's getting in the way of you doing your day to day, then absolutely,
Yeah,
we are here.
totally.
And we're here when people are feeling well too. So we get the question a lot of, well, when's the best time to come to pelvic floor therapy in pregnancy? Do I wait till 3rd trimester or can I come, like, when would I? And
Mm-hmm.
it depends. We see people throughout pregnancy. So people sometimes will come in even when they're trying to conceive or when they are in their first trimester to get established. And we support that and provide them resources as needed. Sometimes people are coming in what we call for wellness. And hey, I just want to have this support along the way. If I experience any discomfort, if I experience any urinary or bowel or pain concerns, I want to be able to have your support, and that's great. And we support them. Okay, let's check in next month, or let's check in the next trimester and follow with you, or do more of like a birth prep from a pelvic floor perspective and helping them learn how the pelvic floor can be optimized for birth or be the most in control of lengthening and relaxing their pelvic floor in birth, or being prepared for what to expect for pelvic health with C-section prep for postpartum too.
Yeah.
So it can be wellness is my point there. And it doesn't have to be something hurting in order to come see us.
Yeah, it can be preventative as well, which I really appreciate. My last point that I wanted to touch on is how receiving pelvic floor therapy in your pregnancy can positively impact your postpartum care. And I don't want us to forget postpartum. I know that even when our clients are dealing with their doula and have their relationship with their doula, they're thinking that we're just going to focus on birth because they hired us for birth. But we oftentimes will hit pause and we're like, no, let's talk about postpartum too, because we want to set you up for success. So talk to us, because I find this really interesting, how receiving pelvic floor therapy during pregnancy can impact in a positive way your
Right.
postpartum journey as well.
So what I find and what we see is that when we work with clients during pregnancy, that we then
Mm-hmm.
see postpartum, they're really set up for success in, hey, in those first 6 weeks, how should I be moving? How much exertion should I be doing
Mm-hmm.
in those first 6 weeks before returning to before returning to walking, work, exercise? It depends what it looks like for that person. Sex, right? What are the parameters around that? Because we really have this little to no information a lot of times there on how we should be feeling in those first few weeks while we're just beginning to heal. So I find that when we go over when someone's pregnant and especially in their third trimester, we start touching on, hey, these are some things to expect postpartum. This is what to look out for. Here's how I want you to start using your core when you are lifting baby, and caregiving is doing all the things you're going to be doing when you're lifting that heavy car seat that we all know is more than 5, 10 pounds or whatever we're supposed to be lifting early on. So by preparing them and what to expect and how to engage their core properly and use different breathing mechanics or what we call like pressure management strategies that really help set the stage for healthy healing in their abdomen, core, pelvic floor, whether vaginal or cesarean birth.
I love that. So this has been I learned some things. I really hope that those that are listening, we've added to their toolkit and now see pelvic floor therapy and pelvic floor health in a different light. And please look away from the incontinence pads. That's not the fix. And I don't mean to laugh, but those commercials like are just such in the top of my mind because they make it seem that like that is the fix all. Like, this is a fix when really it's not even a band-aid because who wants to walk around soiled, right? So it's not even a band-aid and it's not really getting to the root cause. So I really hope that our listeners have learned something and that if you're experiencing any of these things that now finally you're not alone because so many of us experience whether it is incontinence or you're peeing when you're laughing too hard or when you're working out or something like that, Saige can help. So we're going to link
Absolutely.
how to reach Saige and the Bloom team and some resources with them as well. Thank you so much, Saige, for being part of the Motherhood Kit and lending your voice to this conversation.
Thank you for having me be a part. It's a pleasure.
Bye. Thank you for joining us on this episode of the Motherhood Kit podcast. I hope that you're leaving with an aha moment about what is the pelvic floor and what sorts of things you can get treatment for today. We don't have to live in silence or be ashamed of a little, trickle while we're working out or when we sneeze or laugh. None of those things are normal. So I really hope that you take the time to focus on your health, specifically your pelvic floor health. Let's continue the conversation. I love to chat. Connect with me on Instagram at Yamel Belen or on TikTok at the Motherhood Kit, as well as YouTube. Your feedback means the world to me. If you enjoyed today's episode or any other episodes, please consider leaving a review on your favorite podcast platform. And don't forget to hit that follow button so you never miss an episode. Thank you so much for being part of this wonderful community. Let's continue to hold hands in this season of motherhood. Until next time,